What I think music therapy is, it's about making contact, clinical contact. So we want to establish trust, familiarity, success with creative, often improvisatory activities that tap into the strengths of, say, a child with autism spectrum disorders. Some autistic children have a lot of difficulty working in a structure. So we might provide more, once again, creative, open-ended, free-form activities where it's not just right and wrong, let's do it over again. But anything they do might be relatively successful as long as it's in a broader context, such as playing a metallophone without throwing the mallet, so they could play anything they wanted rather than trying to learn a song. And this is in part the difference between music education, which is learning the song, which is developing music skills, which is developing information and knowledge and understanding of music, versus using music as a tool to achieve therapeutic goals. Music therapy is most effective as a form of almost play therapy with sound. So we're dealing with vocalizations, that might not be verbal, it might be pre-verbal. We're dealing with use of instruments for self-expression, sometimes movement, but one has to be creative and improvisatory with it. It's not like just teaching 7-year-old Johnny how to play this old man. It's about following the ability and the needs and the direction of the child. But in dealing with disabilities, it brings out strengths and qualities that words and other rote kinds of activities and other behaviorally based activities. So it touches the identity, the individuality, the creative spark, and the need for expression. We all want to be heard. I think from birth till death, we all want to be heard and understood.